Today's topic is asthma, and we are focused entirely on what you need to know to pass the NCLEX. The single most important concept to remember is that asthma is a reversible airway obstruction. The exam will try to trick you by blurring the lines between asthma and COPD, but COPD is irreversible. Asthma is not. This reversibility is key. The pathophysiology involves inflammation and bronchoconstriction in response to triggers like allergens, exercise, or cold air. On the exam, a question might describe a patient who develops sudden wheezing after jogging in the cold. This points directly to an asthma diagnosis and not a chronic progressive disease. When assessing an asthma patient, you'll look for classic signs like dyspnea, coughing, and expiratory wheezing. But the NCLEX loves to test on the most dangerous signs. If a patient who was previously wheezing suddenly has a silent chest, this is not an improvement. It's a medical emergency indicating the airways are so constricted that almost no air is moving. This patient is on the verge of respiratory failure. Expect a priority question where your first action is to call for immediate help and prepare for intubation. Medication management is the most heavily tested area of asthma. You must know the difference between controller and rescue medications. Rescue medications, specifically short-acting beta-agonists or SABAs like albuterol, are for acute attacks. The NCLEX will present a scenario of a patient in acute distress and offer several inhalers as options. The correct first choice is always the SABA. A common trap is choosing a long-acting beta-agonist or LABA like salmeterol. Giving a LABA during an acute attack is a critical error because it's too slow-acting and can increase the risk of asthma-related death if used alone for rescue. Controller medications like inhaled corticosteroids are for daily prevention to reduce inflammation. Here is your essential memory aid for patient teaching on inhaler use, which is a frequent topic for Select All That Apply questions. Remember B before C, which stands for Bronchodilator before corticosteroid. If a patient is prescribed both an albuterol and a steroid inhaler, they must use the bronchodilator first. This opens the airways, allowing the corticosteroid to penetrate deeper into the lungs and be more effective. The exam will test this sequence of administration. Finally, you need to master the asthma action plan and peak flow monitoring. Questions will describe a patient's peak flow reading and ask what the nurse should instruct them to do. Know the zones. The green zone, which is 80 to 100% of the patient's personal best, means their asthma is well controlled and they should continue their current medication plan. The yellow zone, from 50 to 80%, indicates caution. The patient should use their rescue inhaler and may need to contact their provider. The red zone, below 50%, is a medical alert. The patient should use their rescue inhaler immediately and seek emergency medical attention. The NCLEX expects you to know these percentages and the precise action for each zone, as it's a direct measure of your ability to provide safe patient education and intervene appropriately.